I was one of those kids who had a little chemistry set when I was growing up, always asking questions. As a Latina first-gen student, there weren't a lot of role models. My parents told me, you just keep following your dreams. This education will give you something that nobody can take away from you. If you want to have this education, you should do it. And I did, in the end, loved to learn. I just loved education. I love learning.
Her name comes up everywhere, like in every part of the mission, in every part of the enterprise. And that's pretty unique. She's played so many different roles in different parts of the organization. I don't know if there's a better term than referring to her as a powerhouse.
She does everything. We call it the triple mission of teach, research, clinical care. She's added on the fourth, which is a large leadership role.
She really serves as a role model to demonstrate that how you go about doing the work is almost as important as the work you accomplish.
She's touched so many people in all of the mission areas that we do as a School of Medicine, and bringing on more diverse, outstanding faculty, helping them be successful.
She just cares deeply. She's truly invested in wanting people to become the best versions of themselves.
At Stanford, my approach to my science was to be practical and to see how can my science inform improving lives around the world, and especially pediatric lives. And that is where my career really headed. I realized that I loved working with viruses, and ultimately then went on to do some training at the Centers for Disease Control and Prevention. I loved the idea that viruses were something that I could work with and that I could challenge with these vaccine technologies that we were developing. And so that was really where I found my calling. I thought 20 million children a year at the time were dying under the age of 5 around the world from diseases that here in the US we didn't even know about. For the first part of my career, I was working on HIV and AIDS in the United States to really support the work of how do we understand pregnant women's issues with HIV and children's issues. Coming out of the CDC experience, I was really looking at populations broadly. When I was offered a position to come back to Stanford as a tenure-line professor, I was very excited because I thought this is a chance for me to really look at the science. I walked in the door and I immediately started the pediatric HIV clinic. We set up programs to help screen women for HIV, which in those days, this is in the late 80s, early 90s, we got a lot of pushback from all around saying, well, it doesn't affect women and children. Why do we need to screen? It's a waste of time and money. Well, we pushed and pushed hard, and we got a lot of programs in place. Now it is routine to test pregnant women and women in general and populations in general for HIV. I got a call from my former colleagues at CDC and NIH, and they said, we want to start a pediatric HIV prevention program in Zimbabwe. Are you interested? Well, first of all, I had 3 little kids, and I was really focusing on my polio research, but the opportunity was important. It was an opportunity to really focus on a disease that was killing pregnant women, it was killing children, and here was an opportunity to really take our state-of-the-art work here in the US and take it elsewhere and help partner with people outside the US. So I said, give me a year and I will be on board. So I launched into that career, spent 20 years working in sub-Saharan Africa. We set up huge programs there, which has really made a big difference, not only in the lives of children, but women and families all around the African subcontinent. We have to be ready for the unexpected. That is part of my job as a global health researcher and an epidemiologist. When you're facing an emergency, you have to solve the problem that's at hand. And that's what happened with COVID. Now, it just so happened that I was teaching a class that I've been teaching for many years called Epidemiology of Infectious Diseases. And in January of 2020, I decided that we would track this virus. And as time went on in January and February, it started looking scarier and scarier. I worked with the dean on a regular basis, and I realized I have to say something in my dean's role here, because this is looking like it's going to have an impact, not just in China, where it was identified, but possibly around the world.
We were having almost daily 7 a.m. huddles with all the senior leadership because the information was happening so quickly and changing. And we're often turning to Bonnie. Bonnie, give us a sense of what's happening outside of Stanford? What are you hearing from various public health agencies? What's happening around different policy? What's happening with the pandemic in general? And so she had this really effective ability to talk about the complexity and the uncertainty, but also in a way that was really reassuring. And I think we needed reassurance at that time. And I think for me personally, I really valued her partnership in trying to bring, I say, calm and reassurance to a time that was really, really difficult and obviously unprecedented for how we would manage through it.
When the pandemic started, we ultimately worked with our virologists here at Stanford to develop the first FDA-licensed PCR test for SARS-CoV-2. The federal government had some problems with their own tests, so we developed our own. We were the first. At one point, we were providing about 30% of all the tests in California here at Stanford.
Bonnie's history of understanding infectious disease, her research and advocacy in health equity, her understanding of community and community health, her depth in science and knowledge of vaccines. I mean, all of those end up being such critical needs during the pandemic. Bonnie was the person who really can provide and blend all of those key pieces.
How do we learn from what has happened before? This involves public-private partnerships. It involves more investments in research, investments in better ways to communicate to the public, and to especially build trust in public health. If you don't have a good public health infrastructure, you are not going to be able to take care of your populations. And so we need to build that infrastructure and the trust in that infrastructure.
We have a number of senior associate deans who work with us and focus on different areas. And one was focused on the Office of Faculty Development and Diversity, and that person was leaving. Bonnie was the first person who came to mind. I said she would be perfect. She's really committed to faculty development. She values diversity. And, she knows how to reach out and include everyone. Her real focus is on building a diverse faculty population and to make sure that they're successful.
There is no more important role of an academic medical leader than building the next generation. Most important ideas come early in your career. We want to make sure we don't stifle those ideas, and we want to make sure that the ideas are taken forward by people who really understand how to be leaders. What I'm trying to do in my office is to demonstrate that diverse viewpoints are always going to enrich the dialogue. The other piece of what I do is try to diversify the definition of what faculty work is so that they can really bring forward ideas that may not be considered mainstream, but they may be great ideas looking forward.
I think both Bonnie and I would say it's partly about the faculty development, but it's really about the investment in our people. It's an investment in saying we bring people to Stanford Medicine so they can become the best. And we want to invest in not only their own development, but also in community. I think her faculty development programs have been a reflection of that.
In your leadership role, you need to bring others forward because that is how we are going to continue to improve our society. People here in this institution really believe in equity and health and well-being for everyone. And our ability to really foster that among our academic workforce is really just going to be able to take that forward so that it's not just affecting our small community here, but our global community as well.
When we think about the superstars and powerhouses of Stanford Medicine that truly have been not even the triple threat, right? So someone who's been an unbelievably acclaimed clinician in her field, someone who's led to discovery and research, someone who's been a big educator, and in some ways also has been a big advocate from a policy and national, she's kind of done it all. She's done it in all places. It's almost overwhelming. I don't know how feasible it will be for people to continue to be so successful across different mission areas, locally, regionally, and nationally, which is why we often joke, Bonnie's the powerhouse, and I can't imagine someone more deserving of the Dean's Medal.